Um, but amendment number 3 I do have, which is the behavioral IT health amendment, and I think Senator Stabenow may want to speak on this also. She's spent a lot of time on this issue. And as you know, Mr. Chairman, under the American Recovery and Reinvestment Act of 2009 and under the HITECH Act, we created this incentive program for the adoption of electronic health records, which I think is a good idea. And I believe that there was an oversight in the establishment of those electronic health records because it did not include behavioral health, mental health, or substance abuse treatment professionals or facilities in the program. In addition to mental illness, many patients often have other health disorders, we were told. There's a recent study by SAMHSA, the Substance Abuse and Mental Health Services Administration, points to a particularly high incidence of cancer, heart disease, diabetes, asthma among the more than 6 million Americans served by the public mental health system. So this amendment would allow these critical behavioral mental health providers to participate in Medicare and Medicaid incentive programs for electronic health records. Senator Stabenow apparently mentioned earlier in my absence this tragic case of the woman who crashed her car actually right near this building into a guardhouse. And I think that's an example of where the mental health system wasn't communicating with the other health providers, and there was a gap. We're learning more about that now, but that's an example that's very close to home for many of us, and certainly to the Capitol Hill Police. This amendment would allow these critical behavioral health providers, mental health providers, to participate in Medicare and Medicaid incentive programs, again, for electronic health records. So it would also create a parallel life timeline for those incentive payments and Medicare penalties for the newly eligible behavioral health providers. I believe that this increased coordination between behavioral health providers and other health providers is essential to ensuring that the country's mental health system functions properly and that we avoid these miscommunications. The policy proposed in this amendment, Mr. Chairman, I'm told does have an estimated price tag of $1.1 billion over 10 years. We're still looking into that, but of course I will withdraw the amendment today, and that we are not dealing with offsets today. But I would like to continue to work with the chairman and Senator Stabenow and other members of the committee on both sides to find ways to improve coordination of behavioral health and mental health services.
All right. Senator Stabenow.